June 23rd marks the 5-year anniversary of an historic agreement New Jersey made to improve its child welfare system, one notorious for making mistakes that put kids in danger. The Star-Ledger asked the state for permission to see what it was like on the front lines, working with families in crisis. Last year, the Department of Children and Families said yes. Under the watchful eye of a federal judge, the state has spent nearly $950 million to expand child welfare services. The money has gone for programs like the Nurse Family Partnership, a nationally renowned program to prevent child abuse and neglect. Registered nurses make house calls to make sure first-time pregnant mothers and their babies are getting regular checkups. They also provide hands-on instruction on how to bathe a baby or how to make a sleeping and feeding schedule. Since the state took responsibility for the program 2 years ago, it has expanded from 2 to 15 counties. The state also invested in a stalled program for children suffering from serious behavioral problems or mental illnesses. Like a SWAT team, counselors and social workers from the Mobile Response and Stabilization program are sent in to troubled homes. They serve as a sounding board for stressed-out parents and link the family whenever possible to services that will keep a child in home or out of jail and out of a hospital. That can mean paying the rent to prevent an eviction, or arranging for a child to see a therapist or a mentor, or attending meetings at school. The central mission of the child welfare system is to protect children and, whenever possible, preserve families. The Division of Youth and Family Services, known as DYFS, has enlisted more outside help with those decisions. DYFS has the authority to remove a child from a home it suspects is dangerous. But if parents show a willingness to change, DYFS may send them to a family reunification program. One of them, Reunity House in Essex and Passaic counties, hosts court-ordered visits between parents and their children who are in foster care. Social workers and counselors observe and offer parents instruction and advice on how to be better caretakers. When a judge rules reunification is not possible, DYFS transfers a child's case to its adoption unit. The reform effort initially closed these specialized adoption offices, but when the number of adoptions started to plummet, the state reconstituted the special units. Last year, DYFS set a state record, completing 1,540 adoptions. New Jersey has agreed to remain under court supervision until at least 2012. A federal court monitor says the state is making progress. But by next year, the state will have to show tangible proof the families it serves are benefiting from these changes. For the Star-Ledger, this is Susan Livio.